sixth and final part in my weaning and extubating series, and I'm going to cover how to actually extubate a patient in this video. At this point, your patient is awake, they are on no or minimal sedation, they've been on a spontaneous breathing trial for 30 minutes up to 2 hours, you've gone to the provider, you've shown them all your weaning parameters, you've gotten an ABG if they want one, you've checked if they've had a cuff leak, you've made sure they're following commands, they're hemodynamically stable, they don't have a lot of secretions, they're able to protect their airway. That's a lot of things, a lot of checky boxes. And now we're gonna extubate our patient. So at this point, we have an order to extubate our patient. I will call my respiratory therapist and have them help me with this. It's just easier to kind of have 2 sets of hands when you're going to extubate. The equipment that you're gonna want at the bedside is working suction, ready to go, a bag valve mask, a nasal cannula, and then your cardiac monitor. So you're gonna have your pulse ox, you're gonna have your, ECG, all that hooked up. At this point, I'm educating my patient on what we're going to be doing, as well as the family. If there's any family in the room, I will see if they want to stay and be there for the extubation, or they're welcome to step out if they are a little squeamish. A lot of times the breathing tube, when it comes out, has a lot of ooey gooey secretions, and if people aren't expecting that, they can not do so well with it. I will suction out the patient's mouth the best that I can to get any last minute secretions that are kind of piling up in there. I'm gonna make sure that the head of the bed is up at the highest angle that we possibly can. And then we're going to remove the patient's securement device or Hollister or tape or whatever's on their cheeks, kind of get that off and ready to go. We'll deflate the cuff and pull the tube out. Here's what an ET tube looks like. So this is the little cuff or balloon at the end. This is deflated. So when it's inflated, you'll see it actually puffed up bigger. And then this is the pilot line and the pilot balloon. So you'll actually hook a syringe here and pull out a couple cc's of air. And that little pilot balloon should get nice and squishy, like it should be flat, and that deflates the cuff. I'll usually take a chucks or something, kind of have it on the patient's chest, so that way when you pull out the ET tube, and sometimes the patient has an OG or something that comes along with it, we can kind of just put it on the chucks, wrap it up really quick so it kind of can get out of the way. I'll have suction ready and I'll kind of suction the patient's mouth out. Sometimes respiratory therapists will have the patient cough when they're pulling the ET tube out. Sometimes patients just naturally cough. That's just kind of what happens when it gets pulled out, but I'll encourage the patient to cough up any secretions they have into that yonkower, whatever you want to call it, guys. I'll also have a nasal cannula ready to go. Some patients just need a little, couple liters temporarily, and that's how we extubate a patient. I hope this series was helpful. Let me know if you have any further questions, and I'm happy to further explain things because I know this is a lot of information.